Welcome to Perfect Guardian, and I am going to tell you about the skin cancer diagnosis, treatment, and the outcome. Now, how do dermatologists diagnose the skin cancer? To diagnose skin cancer, a dermatologist looks at the skin. A dermatologist will carefully examine growths, moles, and dry patches. To get a better look, a dermatologist may use a device called dermoscope. The device shines light in the skin. It magnifies the skin. This helps the dermatologist to see a pigment and structures in the skin. If he finds something that looks like a skin cancer, he will remove it or the part of it. The removed skin will be sent to a lab. Your dermatologist may call this a biopsy. The skin cancer cannot be diagnosed without a biopsy. A biopsy is a quick, safe, and easy for a dermatologist to perform. A biopsy should not cause anxiety. The discomfort and risks are minimal. Now, how do dermatologists treat skin cancer? There are many treatments for skin cancer. He selects treatment after considering something like what type of skin cancer this is, where the skin cancer appears on the body, whether the skin cancer is aggressive, stage of the cancer, how deeply the skin cancer has grown, and whether it has spread. It depends upon the patient's health. After considering these things, your dermatologist will choose one or more of the following treatments that I am going to tell you. Now, first of all is surgical treatment. When treating skin cancer, the goal is to remove all of the cancer when the cancer has not spread. This is often possible. To remove skin cancer, few surgical treatments may be used, like excision. To perform this, the dermatologist numbs the skin and then surgically cuts out the skin cancer and a small amount of normal looking skin. The normal looking skin is called a margin. There are different types of excision. Most of excisions can be performed in a dermatologist's office. Now, Mohs surgery. A dermatologist who has completed additional medical training in Mohs surgery performs this procedure. Once a dermatologist completes this training, the dermatologist is called a Mohs surgeon. Mohs surgery begins with the surgeon removing the visible part of the skin cancer. Because cancer cells are not visible to the naked eye, the surgeon also removes some skin that looks normal but may contain cancer cells. This part of the surgery is performed one layer at a time. After removing a layer of the skin, it is prepared so that the surgeon can examine it under a microscope and look for the cancer cells. If the surgeon sees cancer cells, the surgeon removes another layer of the skin. This layer by layer approach continues until the surgeon no longer finds cancer. In most cases, Mohs surgery can be completed within a day or less. The cure rate for skin cancer is high when Mohs surgery is used. Now, curettage and electrodissection. This surgical procedure may be used to treat a small basal cell and squamous cell skin cancer. It involves scraping the tumor with a curette, a surgical instrument shaped like a long spoon, and then using an electric needle to gently burn that and burn the remaining cancer cells and some normal looking tissues. This scraping process is typically repeated 3 times. The wound tends to heal without stitches. Sometimes curettage is used alone. Now, there are some other treatment also. Surgical treatment is not right for every case of skin cancer. Some patients cannot undergo surgery. Sometimes surgery cannot remove all of the cancer and more treatment is used to help get rid of the cancer. If the skin cancer is caught very early, surgery may not be necessary. Other treatments for the skin care are immunotherapy. This treatment uses the patient's own immune system to fight the cancer. The patient applies a cream to skin as directed by the dermatologist. Then cryosurgery. The dermatologist freezes the skin cancer. Freezing destroys the treated area, causing the skin and cancer cells to slog off. Now, chemotherapy applied to the skin. The generic name for the medicine used in this treatment is 5-fluorouracil or 5-FU. The patient applies 5-FU to the skin cancer. It destroys the damaged skin cells. When the skin heals, new skin appears. Then the chemotherapy. If the cancer spreads beyond the skin, chemotherapy may kill the cancer cells. When a patient gets chemotherapy, the patient takes medicine. These medicines may be swallowed, injected, or infused. The medicines travels throughout the body and kills the cancer cells. The medicine also destroys some normal cells. This can cause side effects such as vomiting and hair loss. When this therapy stops, the side effects usually disappear. Now, photodynamic therapy. This treatment consists of two phases. First, a chemical is applied to the skin cancer. This chemical sits on the skin cancer for several hours. During the second phase, the skin cancer is exposed to a special light. This light destroys the cancer cells. Then there is radiation therapy. Radiation may be used to treat older adults who have a large skin cancer. A skin cancer that covers a large area or a skin cancer that is difficult to surgically remove. Radiation therapy gradually destroys the cancer cells through repeat exposure to radiation. A patient may receive 15 to 30 treatments. This treatment is often only recommended for older adults. Many years after a person is exposed to radiation, new skin cancer can be developed. Now, what are the outcomes? That I am going to tell you in very short. If it is caught early and properly treated, a skin cancer can be cured. Even melanoma, which can be deadly, has a cure rate of almost 100% when treated early. Even if you get a clean bill of health, you need to continue to see your dermatologist. Once a person gets skin cancer, the risk of getting another skin cancer is higher. Sometimes skin cancer returns. Your dermatologist will tell you how often you should return for the checkups. Now, without early treatment, the outcome is not as favorable. A skin cancer can grow deeply. Removing the cancer can mean removing muscles and even bone. Reconstructive surgery may be needed after the surgery to remove the skin cancer, and skin cancer can spread. If the cancer spreads, treatment can be difficult. Treatment may not cure cancer that spreads. Thank you. Please subscribe to my channel Perfect Guardian and give your